I'm Mitt Landrum. I'm sitting here with Tom Carl, who's the president of Parkland Health Center here in Farmington, Missouri, a longtime Farmington resident.
25 years.
25 years, that qualifies.
Mm-hmm.
It's a long time. And we thought we'd chat a little bit this afternoon about Parkland. It's such an important institution in our town. It's been here for 40 years. Down through the years, it's just been a tremendous asset. And with everything going on in healthcare, there's just a lot of things happening. So we thought we'd just check with Tom and see what is going on. Tell me a little about BJC here in Farmington, Tom. Why don't you give us a little introduction, please?
Well, the hospital itself has been here since 1969, and it was started, basically by a group of local physicians and community leaders like your dad.
Yes.
It was an independent independent hospital for up until the late 80s, early 90s, when we did the merger of the Bonne Terre Hospital and the Farmington Hospital. Became part of the Christian Health System, and then a year later BJC was formed when Bard's Jewish Hospital and Christian got together. So we've been a part of BJC since the beginning, and there's been a lot of I think a lot of very good progressive investment in the community. Certainly BJC has brought a level of expertise in a lot of the niche areas of healthcare that we deal with these days, that helps us concentrate on the local operation here.
I know right from the start with BJC, and I guess with the Christian organization at the beginning, there was a big investment made because they built a clinic for the doctors. Didn't they, to help stabilize the doctors here in town?
Well, we built the medical office building here on campus. We also re-gutted the entire hospital, basically, outside of the inpatient areas, and we moved all of the outpatient areas over to the east side of the hospital, close to the medical office building, and then had the inpatient services over on the west side. And then at the same time, I think in 95, we opened up the Bonne Terre facility on the highway up in Bonne Terre.
With so many rural hospitals having to shut down, and I can think of 3 or 4 in the area down through the years that they've just really struggled. How is it that Farmington's been able to succeed all these years?
It all starts with medical staff and caregivers. And I think that's true for any hospital, large or small. And whenever you have a group of healthcare professionals that are very engaged in what they're doing, they're very engaged in their community, it helps make hospital work happen within that community. And so I think first and foremost, that's where it all starts. The people that I've been associated with here over the years are a very, very good group of people that are passionate about what they do. They're a good, compassionate group of people, and they're hard-working, team-oriented people, and that combination is really why what's really brought the success. It's certainly having the strength of BJC behind us, the balance sheet of BJC behind us, and some of the specialty and expertise within certain areas of medicine certainly adds a benefit. So the whole package has been good for the community, I think.
Yeah, I think you're exactly right. Just my limited understanding, you have to have doctors to make things happen, and I know attracting doctors can be challenging out here in Farmington and outside the city. So what has that been one of the biggest challenges for you, is attracting doctors?
It's always a big challenge. It's a challenge for any hospital, we've taken some different approaches. We've tried to focus on kids from the local area that have gone through medical school that might be coming back. Those physicians tend to do very well, but it's a tough job in any healthcare environment. Our area, there's a lot of competition for a few number of physicians, and you need to be looking for somebody that's got a rural practice in mind, a rural community in mind. Farmington sets up very, very well for that. And there's very good access to the metropolitan area, a great school system, which is very important to people that are going to be relocating here. So, I think we've got a lot of advantages over a lot of other communities. because of that.
Yeah, that's
Yeah.
good. The hospital, have we had any recent accolades or anything like that at the hospital?
Yeah, we did receive some recognition from PRC, the national group that measures patient satisfaction for our inpatient medical surgical unit and our OB unit. We just received those awards earlier in the spring. So, we had received the top 100 hospital designation from Thomson Reuters for a couple years in a row recently, and so and then there's a few others that have kind of come along, so it's nice to be recognized. You don't necessarily do it for those reasons, but yeah, we sure have.
Well, that is great, and I know a lot of that is a tribute to your leadership here at the hospital. I think you've just been great.
Oh, well, thank you.
Parkland.
Humbly, thank you, but I was interviewing. I'd just been on vacation last year, and came back. And the day I was back, I had an interview with Louis at the radio station, and Louis said something about the hospital going on. Well, I've been gone for a week and a half. I said, the hospital operates by itself, and he kind of looked at me like, well, what do they need you for? And I said, well, that's a good question. But this is healthcare in particular. It's all about team. It's all about team, and there is no way you could do it, and without the right leadership within those caregiver areas too, the physicians, the nurses, everybody else. I mean, they all step up to the plate and make it happen.
Well, yeah. What do you see as the future here, Tom?
The future is, it's going to be an interesting, we're wrapped up in health reform, whatever shape that takes. I think that what you're going to see, if I were to, we have a document that we call 2020 Vision here, and when you look out over the next 5 years, I think you're going to see a lot of investment in information technology. Hospitals, by and large, as an industry, are behind other industries in the country as far as their use of information technology in their day-to-day operations. They have, tended to, over the years, invest in clinical technology, CTs, MRs, cath labs, those kinds of things, and there is a limited amount of funds, and so you're going to see a much larger investment in information technology. We're getting ready to go live with our electronic records out on the floor on September 11th. Following that, probably in 2012, we will go live with computerized physician order entry, and beyond that, then you're going to see, I think, portals in which patients can get immediate access to their health information after they've been visiting the physician's office or the hospital. And so there's a lot going on. There's going to be a lot of investment there. Need more physician office space, and I think that's probably in queue as well. And I think that's going to be a lot of the investment over the next 5 years. Will be really internally focused there for a lot of those reasons. And then the next 5 years, some of the clinical technology will start to. We just invested very, very heavily, in particular in some of the radiology areas and that kind of thing. And the life for those assets is 5 to 7 years, and so in the last 5 of that 2020 vision, you're going to see more reinvestment there, and then we've got to assess where we are from a capacity standpoint on the inpatient side, the operating room, that kind of thing. So
Sure.
More of the traditional capital investments. We've done a lot of that, and so I think you're going to see the next few years with the IT investment.
Medicine in particular is one industry that is in for tons and tons of change,
Yeah.
and a constant need for reinvestment and fresh people coming into it.
Yeah, it sure is, and it's changing the nature of it. Of course, I'll date myself. I remember when the first PC was brought into the hospital, but it's also the changing nature of what people are looking for in the profession. There are still some of those that I think have the traditional lifelong vocation, but then there are also folks that are coming out of med school that have certain quality of life issues, and so you're seeing the emergence of hospitalist services where some physicians might be geared toward more of an outpatient practice setting. Some physicians may like inpatient, and instead of trying to do both, there's some segregation that's starting to take place. It's been an interesting development, and I think it's one that's going to continue.